Hi, my name is Yasmine and I'm going to present to you my comprehensive final assessment. Before we begin, I just want to make a side note that I've already gathered all my equipment and my client is aware that I'm going to be verbalizing all the findings as we go along. I've already washed my hands and closed the door to provide privacy. Let's begin. Hello, Mrs. M. My name is Yasmine. I'm going to be your nurse today. We're going to do a physical assessment. How are you?
I'm great.
Okay, I'm going to ask you some questions. So what is your reason for coming in today?
I just came just for a checkup. I'm just healthy. I'm here to be checked.
Okay, and do you have any past medical history?
No, I have only thyroid.
Okay, any childhood illnesses?
No.
Okay, and are you up to date on all your vaccines, like your pneumonia and flu vaccine?
Yes.
And do you know the date of your last physical exam?
That was like 3 months or 4 months ago.
Okay, perfect. Do you have any food or drug allergies?
Nothing that I'm aware of.
Okay, and do you take any medications?
Only thyroid medicine.
Okay, excellent. So now we're going to go ahead and begin with the exam. So first thing I'm going to do, I'm just going to state that, some general things.
Okay.
So Mrs. M is female, and her level of conscious, she's awake, alert, oriented. Nutritional status, I can see that her body weight is appropriate for her body height. And she's mood, affect, she's very appropriate for the situation. And let's see, her body posture, is she sitting upright? And I don't see any apparent malformations or deformities. And let's see, her hygiene, she's very clean. Hair and nails are clean. So we're going to go ahead and move to the head and face exam. So I'm going to look at your hair. I'm going to stand behind you, Miss M.
Okay.
Scalp is clean, free of lesions, free of any deformities. Her hair is a nice, fine texture, curly, black. We're going to go ahead and just look at your head. It's normal cephalic, no protrusions, no anything abnormal. I'm going to go ahead and just look at your sinuses here. Kind of go up here. So do you feel any pain when I palpate here?
No.
And how about here?
No.
So her frontal and maxillary sinuses are okay, and I'm going to go ahead and just feel your temporal pulses, and I'm grade is about 2+. I'm going to have you open and close your mouth, and close. Any pain when I do that?
No.
So temporomandibular joint, it's clear movement, no crepitation or clicking when she does that. Okay, so we're going to go ahead and do some tests for facial symmetry. So Miss M, I'm going to have you just smile, okay, and then frown. And puff your cheeks out. Okay, excellent. So all her facial movements are nice and symmetrical. Okay? So Miss M, what we're going to do now is we're going to move on to your eye exam.
Okay.
So just looking at her eyes, I can see that her eyelids are nice and symmetrical, and her lacrimal apparati are nice and pink, and I don't see any swelling or discharge. Her sclera, nice and white. Her conjunctiva are nice and pink, no swelling. So we're going to go ahead and move on to the eye tests. So first thing I'm going to do is we're going to have to do the confrontation test. So I have a card here. Okay, and I have another card here which I'm going to grab. So I'm going to have you cover your right eye.
With my glasses?
With your glasses on is fine. Okay? So when you see me bringing my finger, I just want you to say now.
No. 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 No.
Okay, go ahead and do the same thing with the other eye. Go ahead and cover.
No. 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 No.
Okay, so her peripheral vision is intact with confrontation. Now we're going to go ahead and stand, and we're going to see the Snellen eye chart. So go ahead and stand right here at that brown table. Okay. It's approximately 20 feet from the chart, and just tell me the number of the line that you can read.
I could read number 8.
Here, go ahead and cover your left eye, please. I apologize. Okay, and go ahead and cover your other eye and tell me which one you can read.
Number 6.
Okay, so she is 20/30 on the left eye, glasses on, and 20/20 with the right eye glasses on. Go ahead and have a seat, Mrs. M. Thank you. Okay. I'm going to give you this card again. I'm going to have you just stare at me, okay, and cover your right eye, and then uncover, and then cover your left eye, and uncover. Okay, so with the cover-uncover test, I didn't notice any weakness or anything like that. Okay, Okay, perfect. So now we're going to go ahead and do a test called Pearl. So I'm just looking at your pupils. They're equal round, okay? And we're just going to go ahead and shine a light in your eye. Okay. And her pupils constrict, reactive to light and accommodation, so bilaterally. All right, so last test we're going to do is diagnostic positions. So I'm just going to have you follow my finger, both eyes, okay? Okay, so she's able to parallel track both eyes. And we're also going to do a corneal light reflex, so I'm just going to shine this light in your eyes. Okay. And it shines symmetrically on both eyes. Now we're going to go ahead and move to your ears. So, okay, just looking at her ears, I can see that there's no edema, no swelling, anything. I'm going to go ahead and feel, palpating the auricle. And do you feel any pain?
No.
Okay, so she doesn't have any pain when I palpate the pinna, auricle, anything like that. We're going to go ahead and do something called the voice whisper test. I'm going to stand about 2 feet behind you, and I want you to tell me what I'm whispering, okay?
Okay.
3 and 2.
3 and 2.
Okay, other side. 5, 2, 3.
5, 2, 3.
Okay, so she passed that with flying colors. Excellent. Now we're going to go ahead and do the nose. So just looking at her nose, I can see that it's symmetrical and in proportion with the rest of her face. See, I'm going to go ahead and shine the light in your nose, Mrs. M, and have you just face up. Okay. And looking at the nasal mucosa, I can see that it's moist pink, and I don't see any major deformities. The nasal septum is nice and midline, no deviation or signs of perforation are noted. Now I'm going to check for nasal patency. So I'm going to just press one side down, have you sniff inward. Same thing. Excellent. Now if you close your eyes, I'm going to have you try to identify a smell of something, okay? Close your eyes.
Close.
What are you smelling?
Coffee.
Okay, perfect. She's able to smell that without any difficulty. Okay, now we're going to just do, you can open your eyes. I'm going to take a look at your mouth. So just looking at her lips, I can see they're symmetrical when she smiles and when she's relaxed. So I'm going to just shine this light in your mouth. And go ahead and say, ah, ah, and stick your tongue out at me. And then stick your tongue up to the ceiling. Okay, and relax. So what I see is that her her buccal mucosa is nice and pink, moist. Her teeth are white, no discoloration. Everything is in perfect alignment with her gums. And her tongue, when she sticks out, protrudes midline. There's no deviation, no tremor. And her uvula, when she says ah, it rises midline on phonation. Her tonsils, the tonsillar pillars are nice and midline, and I grade them at 2+. There's no exudate or anything. Her anterior palate is nice in a paler color in comparison to the posterior palate, which is a little bit more red. It's an expected finding. And let's see. And the floor of her mouth, I say, is a little more red, but it's expected finding. There's saliva present, so. Let's see, and I don't notice any halitosis when she opens her mouth. We're going to do a test called the gag reflex. So I'm going to stick this tongue blade in your mouth. Okay, so go ahead and open up. Ah. Okay, perfect. So her gag reflex is present. And now I'm also going to have you identify a taste of something that is on this Q-tip here, okay?
Salt.
Excellent. That was quick, and you got it. So her taste is intact. So now we're going to move on to the neck assessment. I can see her neck is nice and midline. Muscles are symmetrical, and it's holding her head upright. So I'm going to go ahead and test your lymph nodes now. So I'm testing the preauricular, the posterior auricular, the occipital, the tonsillar, the submandibular, the submental, the anterior cervical, the deep cervical chain, the posterior cervical, the supraclavicular, and the inferior clavicular. Did you feel anything?
No.
Okay, perfect. And I can see her trachea is nice and midline, no tracheal shift is noted. I'm going to step behind you here, and I'm going to have you just swallow like you're taking a sip of water. And her thyroid gland, I don't feel anything. I'm doing that. So now we're going to do some range of motion on your neck. Okay. So I'm going to have you just put your chin to your chest, back up to the sky. Okay, relax in the middle. Now go ahead and ear to side, other side. Okay, turn towards me. Other direction. Okay, now shrug your shoulders. Okay, perfect. Now shrug your shoulders again against my resistance. Okay, and then turn your head towards me against my resistance. Against my resistance. Okay. So she has full range of motion of her neck against full resistance. All right, now I'm going to go ahead and take a look at your posterior thorax. So I'm just going to take a look at your skin here, and I can see that her skin is nice, intact, brown color, just like the rest of her body. I'm going to go ahead and do a test for chest expansion. So Miss M, take a deep breath, in and out, relax. So she has symmetric chest expansion. Now I'm going to do a test for tactile fremitus. So I'm going to have you just say 99.
99.
99, so you keep saying it.
99. 99.
Okay, perfect. So no abnormal fremitus is noted. Now we're going to do a test for percussion. So just go ahead and relax. I'm going to be tapping on your back, okay? Okay, so the dominant sound that I feel is resonance. I'm also going to do a costovertebral angle test. So what I'm going to do is I'm just going to thump on your back. If you feel any pain, I want you to tell me, okay?
Okay.
This is about the 12th rib, so.
All right.
Ready?
No, it doesn't hurt.
Okay, perfect. Now I'm going to listen to your lung sounds back here.
Okay.
Okay. Deep breaths. Another deep breath. Another deep breath. Another deep breath. Another deep breath. And one more. So all lung sounds, posterior lung fields are clear. On inspiration and expiration, I don't hear any adventitious lung sounds. Now we're going to do the same thing on the anterior thorax. I'm going to check her skin tartar under the clavicle. Pinched skin when returns immediately back to original position. No tentings noted. Her skin in the front is within normal range. I don't see any cyanosis, any pallor. We're going to do the same thing for chest expansion. So I'm going to have you take a deep breath with my thumb here. And I see symmetric chest expansion. We're going to do fremitus again. Okay, so 99.
99.
Sorry. 99.
99.
And
99. 99.
perfect. Now we're going to do percussion again. So I'm just going to be tapping. Okay, so resonant is the dominant sound that I hear. I'm going to listen to your lung sounds. Do some deep breaths. I'm going to come under here. Another deep breath, please. Okay, and then one more deep breath. Excellent. So lung sounds are clear throughout. No adventitious sounds are noted. Now we're going to go ahead and take a listen to her heart sounds while she's sitting up. So I'm going to start on the right second inner space, listen to the aortic sound with my diaphragm. Then the second left inner space to hear the pulmonic. The third left inner space to hear the Erb's point. Then the left lower sternal border to hear the tricuspid. And then the left fifth inner space midclavicular line to hear the mitral. Then we're going to do the same thing again with the bell stethoscope, the aortic, pulmonic, Erb's, tricuspid, and mitral. And S1 and S2 are all regular. I don't hear any abnormal sounds. Everything, no accentuated or diminished, and no murmurs. Okay, Miss M, I'm going to have you go ahead and lie down. We're going to do the breast assessment. And for her privacy, we're just going to keep her covered in her outfit. Okay, so first thing I'm going to have you do, I'm just going to have you put your arms above your head and then to your hips, just like this. So that's a test for retraction, and there's mobility is symmetrical in both breasts, that I can see. I'm going to have you lie back. Okay, I'm going to cover up here. And I'm just going to kind of take a look at the skin. And from what I can see, the skin is a symmetric, the similar brown color, no dimpling or any kind of edema or redness noted. So we're going to start with palpation, okay? So I'm going to start on this side. I'm going to start at the tail of Spence. Any pain or anything noted? Okay, so we're going to start on this side. Any pain?
No.
Okay, and the nipple tissue feels similar, no pain and no discharge is noted. I'm going to have you lift up your arm here. We're going to do under the axilla on both sides. Sorry if my hands are kind of cold.
It's okay.
No nodes or lumps noted. Any pain?
No.
Okay, we're going to do a quick educational thing about how to do a self-breast exam. So the best time to do it is the 4th or 7th day of your menstrual cycle or after your menstrual cycle, because that's when your breasts are less congested. And the procedure is to use the pads of your 3 middle fingers and start in a upper part of your breastbone and work in a circular motion down. Do it while you're lying down and keep your arm up, and also don't forget to do under your arm. If you know anything abnormal, like a lump or any kind of swelling area, make sure you notify your doctor or your primary care provider. And also, after you're done with that part, you want to stand up in front of the mirror and just kind of note size or any kind of normal changes. Okay?
Okay.
So now, while you're lying down, I'm also going to take a look at your chest area just to see heart sounds, precordial area.
Okay.
So first thing I want to look at is just your apical site. So that'll be on the left midclavicular 5th inner space. And I don't see any heaves or any apical impulse, which is good. I'm going to just take a look at the rest of your precordial. And I don't see any visible vibrations or thrills or feel anything, which is good. Now I'm going to have you just kind of relax your back. Sorry, this pillow's kind of... I'm going to just palpate your carotid arteries one at a time. Okay, and I'd rate them at 2+ each, okay? And now I'm just going to go ahead and listen with the the diaphragm, my stethoscope, and flip it back. So we're going to start with the aortic, pulmonic, herbs, tricuspid, and mitral. We'll do the same thing with the bell, aortic, pulmonic, herbs, tricuspid, and mitral. Okay, and then with that bell, I'm going to go ahead and listen to your carotid arteries for any bruits. And I do not hear anything, which is good. So, again, all heart sounds are good. S1, S2 are normal, no accentuation or diminishing, and no murmurs. So now we're going to go ahead and move to the abdomen, okay, Mrs. M? So, it's going to kind of lift up just a little bit. I know it's kind of just from the side.
Okay.
Her skin appears to be similar to the rest of her body. Skin coloration is good, no visible veins, no palpations. Her contour is nice and flat, and her umbilicus is nice and midline, no herniation noted. And so I'm going to go ahead and just take a listen to your bowel sounds. And we're going to start on the right here. Okay, and I will say they're present equally in all 4 quadrants. So now we're going to go ahead and start with some palpation. So I'm going to start lightly. I want you to tell me if you feel any pain, okay?
Okay.
So, anything?
No pain.
Okay, so no mass is felt in light palpation. Now we're going to move to deep palpation. Anything?
No.
Okay, perfect. So nothing felt with light or deep palpation. Now we're going to go ahead and move to the liver. So I'm going to move on your side because it's in the right upper quadrant. And I'm just going to give a little support here to her back. Okay, so I'm going to have you take some deep breaths into the nose, out through the mouth. I'm just going to palpate. Do you feel anything?
No.
So nothing felt on liver palpation. Now we're going to go ahead and do the spleen, and that's the left upper quadrant. So do you feel anything as I'm palpating?
No.
Okay, excellent. So now we're going to go ahead and move to the lower extremities. So as I can see, her lower extremities are nice, symmetrical, brown color, and her muscles are nice, formed, no atrophy noted, warm to touch. I'm going to go ahead and palpate your popliteal pulse. Okay. And this is usually a hard pulse to find, and I don't feel anything, so it's nothing to be alarmed. I don't feel anything, so I'm going to grade it at 0 bilaterally.
Okay.
So now I'm going to go ahead and do the posterior tibial pulse. And then again, I don't feel anything here either, and I'm going to grade it at 0. Those are also another difficult pulses to find. So this is, I'm going to do the dorsalis pedis pulse. Okay, and I'd grade that at 2+ bilaterally. Okay, so that's a good. Now we're going to have you do some range of motion. So I'm going to have you go ahead and raise your leg, just to start with one, up to the sky, back down. Other leg, same thing. Okay, now we're going to do abduction, adduction. Bring this leg out, back to the middle. That leg out, back to the middle. Okay, bend this knee at 90 degrees, and then bend it out. Okay, same thing with the other. Out. Okay, excellent. So full range of motion with the hip. Now I'm going to have you bend your knee, okay, and then extend it. Okay, perfect. Now same thing, bend your knee and extend it. Okay, and then do the same thing, bend your knee, and kind of keep that flexion against my resistance. Okay, perfect. Now do the same thing against my resistance. Okay, now we're going to have you do your ankles. I'm going to have you flex them, and then extend them, and then now bring them outwards, inwards, rotate. Okay, now try to flex against my resistance and back. Okay, perfect. Now fan your toes out, and then scrunch them together. Okay, good. Now I'm going to do something called the Babinski reflex. So what I'm going to do is I'm going to lightly stroke this on the bottom of your foot, okay? Okay, so this is a negative Babinski because her toes curl in, okay? So now we're going to do your upper extremities. I'm going to have you just sit up at the side of the bed. I'm going to come on this side. Okay, so what I'm going to have you do, Mrs. M, is I'm going to have you just put your arms out. Okay, then I'm going to have them put back to center. Then like this, put your palms together. Okay, good. Then I'm going to have you just go like this on each side, like you're swimming. Okay, that's called circumduction. All right, now go ahead and put your arms out like this again, but against my resistance, okay? Try to hold them up. Okay, now do the same thing this way, but against my resistance. Okay, excellent. So perfect. She has full range of motion of her arms against full resistance. So now we're going to do the elbows. Just like you're doing a weight, okay, and back down, and then against resistance this time. Good. Now we're going to do your wrists, okay. I'm going to have you just up this way, okay, and then down this way, and then just kind of you're waving, and then can you move in a circular motion? Okay. Now I'm going to have you do it against resistance, so I'm going to have you try to bend your wrist against my resistance. Okay, now on this side. Okay. Perfect. So she's got full range of motion of her wrist against full resistance. Now your fingers, I'm going to have you just bend them at where they bend. There you go. Then go ahead and grasp my fingers. Okay, excellent. All right, so she's got full range of motion of her upper extremities. So now we're going to go ahead and do some neurological tests, Mrs. M. So first thing I'm going to have you do, I'm going to have you close your eyes.
Okay.
And I'm going to draw a number in your hand, and I want you to identify what that number is. Go ahead and close your eyes. Okay, ready?
1,
Okay, next.
3.
Perfect, she's got it. Okay, so next thing we're going to do is called sternogenesis. I'm going to put some objects in your hand. Keep your eyes closed. I want you to identify what those objects are.
Quarter.
Okay, next.
Key.
You got it. Okay, next thing we're going to do is just light and deep touch, okay? So I'm going to have you close your eyes. I want you to tell me where I'm touching you and if the sensation is deep or light, okay? Go ahead and close your eyes.
My upper
Okay, and is it deep or light?
light.
Okay, and then next one we're going to do one more time.
Uh-huh.
Tell me where I'm touching you, deep or light?
My wrist.
Okay, deep or light?
Light.
Okay, so now we're going to do some facial sensation. I just want you to say now when I'm touching you, okay?
Now. Now. Now.
Perfect. Now we're going to do some rapid alternating movements. So I'm going to have you go like this, just as fast as you can. Perfect. Now I'm going to have you touch your fingers to your nose as fast as you can with your eyes closed. Okay? Good job. Excellent. Now we're going to do some your deep tendon reflexes. I'm going to have you sit up here.
Mm-hmm.
Okay, so first I'm going to do the brachial.
Mm-hmm.
So I'm just going to have you relax. Okay? Okay. 2 plus. 2 plus. Radial. 2 plus. 2 plus. Okay. This triceps. Make your arm go like dead weight. 2 plus. 2 plus. Okay, patellar. Let your legs angle down. 2 plus. 2 plus. Okay, now I'm going to go ahead and do the Achilles reflex. 2 plus. 2 plus. Okay, perfect. So now we're going to go ahead and just do your upper body range of motion and take a look at it when you're sitting upright. So just looking at her upper shoulders are nice and symmetrical. Her scapula are nice and symmetrical. There's no swelling, no edema. Skin color looks nice and intact. Nice brown color, no pallor, no cyanosis. Her nails, nice nail base, 160-degree nail base on both fingers. It's kind of hard to tell the capillary refill because she's got fingernail polish on, but I can see in some areas that she's got good cap refill, good blood return. I'm going to go ahead and check your radial pulses. Okay, I'll give that 2+. Your brachial pulses, I'll give that 2+. Okay, so now what we're going to do is I'm going to have you go ahead and stand up. And I'm going to have you do some spinal range of motion. So I'm going to have you bend forward, stand up, bend backwards, okay, and then midline, then go to the side, and then other side, and then turn like this, okay, perfect. And I'm just going to take a look, when you bend forward again, I'm going to look at your spinous processes, and they're all in alignment, perfectly midline. Now, I'm going to have you, and she's got full spinal range of motion. So now, Miss M, I'm going to have you walk from here to that black pillar in the normal way that you walk. And just walk back towards me. Okay, so she has a smooth, coordinated gait and good arm swing and balanced. Now what I'm going to have you do is I'm going to have you walk in a heel-toe fashion. So what that means is walk on your heel and then your toe. Okay. Heel and toe. And just do the same thing. Walk towards that black pillar, please. Okay. Perfect. So you can just walk back your normal gait. So she's able to walk in a coordinated, smooth fashion, heel to toe. Now I'm going to have you take a few steps on your heels and come back a few steps on your toes. Just forward.
Oh, forward.
Yeah, I don't want you to fall. A few steps on your heels. Okay, and then you can come back on your toes. Perfect. So she walks in a smooth, coordinated fashion on heel and toe. Last test we're going to do is the Romberg test. So Miss M, I'm going to have you close your eyes when you feel steady. And I'm going to have you keep them closed for a period of 20 seconds, okay? All right, so count 3. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. You can open your eyes. So she was able to stay balanced for a period of 20 seconds and no sway was noted. So Miss M, that concludes my assessment. I thank you so much and thank you for watching my comprehensive final.